have said now. Good evening, madam. You have asked the right question. Low back pain, as we all know, is a household thing. Every house has that low back pain. And we should consider low back pain as our friend and not an enemy. Because low back pain shows the mechanical component. When there is a problem inside, pain shows outside, which means it's a friend to us. And there are two components of pain. One is physical component of pain because of the damage, and the other is psychological component of pain, that is the expression of what we feel from inside. And the next point which you pointed out is, it is a household thing. And what I want to tell is, low back pain is the second most common cause one comes to hospital. First is common cold. So no one can escape from low back pain. And whenever someone presents with low back pain, not all patients require X-ray, MRI, anything. The patients who have weakness in legs, the patients who have bladder and bowel symptoms, that is difficulty in controlling urine motion, and the patients in whom the pain is persistent beyond 6 weeks, they are the patients who require MRI. Other patients doesn't require MRI. And when it comes to surgery, whether all patients with low back pain require surgery? No, not at all. As I said, the absolute indications of surgery is weakness in both the legs and when there is difficulty in passing urine and motion. And the other point is, when the patient themselves tell that my symptoms are very severe and I cannot tolerate anymore, then that becomes one of the indications of surgery. And the next question which you asked, madam, is how to prevent low back pain. Prevention of low back pain is only from lifestyle. The most important cause of low back pain is smoking and obesity. If we reduce smoking, the incidence of low back pain reduces. And the second is obesity. So it is very important to maintain a balanced weight right from our 30s to 40s of age. At 50s, our body as such degenerates, and along with obesity, this degeneration adds up, and this causes like very severe low back pain which will be resistant to all kinds of medications. And the next thing how to prevent is by doing yoga and by keeping yourself flexible. If you keep yourself flexible, then the joints and ligaments, everything will be flexible and it will be resistant to injury. But if you are not flexible and stiff, even a minor injury will cause severe low back pain and giving away of all the joints and ligaments. And that is why yoga is very important, and we should always keep doing yoga and keep ourselves flexible. The final point which I want to tell is, do exercises, keep yourself flexible. Rest is always equal to rest. Thank you.